if you are treated by a nonprofit hospital in any state, this is federal law, they've got to have a financial assistance policy, and it's got to be listed on their website and available in any place where patients have access. So that usually includes the admission area, or the waiting room, or the emergency room. And that's something you should be able to ask about at the front desk. But if you've gotten the bill, you can look on the bill and it usually will say, if you need help, financial counseling, or financial assistance, here's where you go for information.
So is there a chance that if a provider is affiliated with a particular hospital, that maybe they would also offer?
It might be, yep. So it's similar to, I think, the insurance. There are provider directories for financial assistance. They're not to be confused with the provider directories for insurance. You can see how people get so confused.
Right. We're not very creative with our terminology.
We're not very creative with our terminology at all. But you can look to see if the provider participates. But I would say, even if you don't see their name or if you see them excluded, it's always worth a conversation with their office to see if they will honor the policy. And if not, what kind of arrangement you can come to. So Quincy was mentioning that, charges are all over the place, and that is true all around the country. There are some places that charge more for the same procedure than others. If you've already gotten the bill and you didn't realize you were in one of those higher charge places,
Right.
Recognize that what they're charging you is the sticker price. Usually, it's not the actual cost of what your care was. So there's wiggle room there for sure. That's how they negotiate down with insurance companies, with Medicare and with Medicaid. And you should, as a patient, feel very comfortable and well within your rights to negotiate from that. Does that mean it's easy? It does not. But I think as much as possible, trying to get that core charge down if you owe it is really helpful. And then avoid, again, being pressured to put this on a credit card. Instead, think about what can you reasonably afford, and whatever amount they say is left, how can you pay that over time? And most places will work with you. Some won't, and that I think is when you may want to go to the media, but you may want to also think about retaining legal counsel, or we've seen this little pocket industry of billing advocates spring up, people who will actually take a look at all your medical bills and review them together and do that negotiating on your behalf. So there are those options as well. Unfortunately, nothing is quick or easy, but it is doable. One little funny wrinkle is we were talking about what are some protections that people want to see. One of the protections we've talked about is not requiring upfront payment in the emergency room. And that's pretty common. So if you've been with a loved one, or if you yourself have been in the emergency room, sometimes they want to collect a fee up front just for having you there. And in most states, that's still legal for them to ask. However, there is a different federal law called EMTALA, the Emergency Medical Treatment and Active Labor Act. It's a long thing to say, but that gives you the right to get treatment in an emergency condition regardless of your ability to pay. So they are required by law to treat you and screen you and to get you to a certain level of stability, or your loved one, even if you can't pay that account. So
and that's not just at nonprofit hospitals?
That's not nonprofits. That's every hospital. So in terms of an emergency situation, that your ability to pay or the pressure you feel to pay, that's a pressure that they're applying, but they are required to treat you. And I think that's where we've had people before say, I've gone in and they've said, well, do you have a credit card, or do you know someone who has a credit card? And don't leave the credit card in your pocket. So
good to know.
Yeah.
Well, there's a little gem.
One thing I would add is that you should understand the state law where you live, because in some states they have protection against supply billing. So I think at least 28 states have taken action to protect people from supply billing. Some law is stronger than the other, but you should know your rights.
What kind of rights? The ones that have taken action?
Like for example, in California, they prohibit providers from supply bill people for emergency, for example, or for the service like radiology or that when you go to in-network facility.
Okay.
So like Mississippi, there's a law back in 2008 or 9, they prohibit supply billing, but nobody knows. So provider didn't know either. So they just charge people and people keep paying.
So how do people find out what the protections are in their state?
So
What do you Google?
you talk to the State Department of Insurance.
Okay,
And they will walk you through what is the protection you have from the state. So go to like Consumer Health Advocacy Organization, go to Patient Advocate, go to Department of Insurance. So they will basically tell you all that.
I have heard from some people that they prefer for their debt to get transferred to the collection agency because they feel like bargaining with them is easier. That they will accept significantly less on a dollar than, the original charger. Is that something that,
That can happen. So, and this is where National Consumer Law Center is really well versed. That can especially happen with older debts. So it's possible for a hospital to outsource its collections. It's also possible after time for them to bundle those up and sell them to a collection agency, and then same the way that we see with mortgages or student loans, those can get transferred to other agencies down the road. And the longer the time has passed between the original date of service and then when they're trying to collect on the debt, yes, by that point the debt's almost worthless. But if you're going to pay $20 for something that was originally $200, they'll take that. They're banking on some people doing that. That is where you do want to be careful. So if your debt is really, really old, we've been mostly talking about what happens when you've got a bill right in front of you.
fresh debt?
Fresh debt. There's also what's called zombie debt. And that's when your debt is really, really old and all of a sudden you're hearing about something that was from close to 10 years ago. You do at that point want to be careful because most states there are statutes of limitations on how long a debt like that can linger. And if you pay something that's really, really overdue, you can actually forego the right to just have the debt forgiven. So that's not an area where we have focused, but I think you would want at that point to consult the Attorney General's office, the Office of Consumer Protection, or legal aid or legal services if you have access to those, to really understand, are you, by doing something that feels good perhaps, actually opening up a can of worms that, it's gone. You don't really need to worry about that debt. I will say, just even thinking about some of the stories I've heard from patients, these are all, we're talking about things that should be within the patient's right to ask. Certainly, I have heard examples of from people who've tried to work with providers and the frontline staff that they're dealing with have made them feel awful for asking for this kind of assistance. And I do think that some of our work with hospitals and health systems has been to say, you've got frontline staff who see it as their mission to collect as much as possible to keep your doors open. And that's one way to approach this problem. But I do think most providers have not been asked or taken it upon themselves to really think about the impact of their own billing and collections policies. They haven't done that at the highest levels. That's a lot of the stories we're seeing. They haven't thought that through. And they haven't shared that with the staff member who may be on the other end of the line with you. So that's where I think your personal support network can become really important. If you are dealing with somebody who's giving you a hard time, being able to fall back on other people who can say, no, this happens to me, this happens to a lot of people, this has happened to me, this is what your right to ask for this is really critical. So we've seen a lot of communities of faith, but other different kinds of affiliated groups really say, nobody wants to talk about this. Nobody wants to talk about their medical debt. They're ashamed. And that's where I think some of the statistics can be really powerful to know that this isn't just you, this isn't just your family, it's not something that you overlooked in the madness around this issue. This is a systemic problem in the US, and it's widespread, and the more we talk about it, the more likely we are to solve it. That I think is something to keep in mind. But I also advise people to just take a walk after one of these hard phone calls and just let it out, because it can be challenging to get what you need. So
Absolutely, we always weave in the self-care practices
yeah,
that help us keep us able to face the next challenge.
right.
I feel like we have just so many takeaways from this conversation that it's been so valuable. Check your bills, ask your questions beforehand, ask your questions afterhand,
Yep.
and just keep trying.
Yes. Yeah, you're going to have to be persistent. And, I think your point about advocacy around this is really well taken, because this is not a system that is set up to support patients and families right now. And this aspect of it in particular is still really hard to navigate. So the more that we can protect people from acquiring this kind of debt, making insurance more affordable in the outset, making it available to, I think we still have 9% of the country still doesn't have health coverage. So, there's still work to be done on that front. But I'm encouraged that we do see so many folks of all political stripes that are taking on this issue and saying, this isn't right. So I'm hopeful that in the next five years or so, we might see some movement and some better protections for patients.
Thank you both so much for spending this time with me and with our viewers. And I'm sure more questions will come up, but they know who they can call.
Yes,
Thank you so much.
Thanks.
Thank you.